they don't have that sort of postural ability to correct themselves. So having that little extra reminder or prompt to straighten can be helpful. That's what comes to mind for me.
And I'm also going to mention that after we go through all the written questions, if there's time, we'll also have a microphone available if people had other questions that popped up during this.
The other thing is with walking, sometimes people list, and so that's where the use of a gait belt, this belt that goes around the waist or kind of helps bring the person back over their center of gravity, can really help, because that's another sort of structural prompt to get the body back in line. And it's very hard for people to correct that on their own.
So the next question is for Joey. So if someone is choking, is it okay to use the Heimlich maneuver?
That's a great question. I think in understanding when someone is truly choking and not passing air, the difference between that. If someone's truly choking and there is an air obstruction, they're not going to be able to get any sound out. They're not going to be coughing. You might hear a little very strained breathing, and in that case, to be prepared for that, going to seek knowledge on how to do the Heimlich maneuver, I do think would be vital and is a great idea for caregivers. Otherwise, with swallowing problems, we might see some distress and just choking that signals that something went down the wrong pipe. But as long as they're coughing and able to recover, then of course the Heimlich maneuver would not be needed. Of course, we want to try to prevent those from happening with some of the strategies that I had addressed today.
Thank you. So the next question is for Dr. Rabinovici. And in PET imaging, I heard that is the T807 or other tracers are radioactive, and if so, are they carcinogenic?
That's a great question. So the tracers are labeled with a very small dose of radioactivity. In fact, that's what the PET scanner is detecting, is the radioactivity. Now, keep in mind that almost every procedure that we do in radiology, aside from MRI scanners, but X-rays, CAT scans, expose your body to radiation. And so how much radiation do you get from doing a PET scan, say with a tau PET scan? Well, it's similar to what you get from a CAT scan of the chest. So it's well within what's considered safe for medical use or for research purposes. Now, it is true that the more radiation you're exposed to over your life, the higher the risk of cancer. And all of us are exposed to radiation all the time. There's radiation in the air when we take an airplane trip. That exposes us actually to higher doses of radiation. And so getting those extra PET scans do increase your cumulative dose, the total amount of radiation that you're exposed to over your life. And the more radiation you're exposed to over your life, the higher the risk of cancer. So there is a link there. But doing these PET scans through research increase your risk by some very, very small number. In fact, it's so small we can't put a number on it. We can't say it's 1% or 0.1% or even 0.01%, but it's more than zero. And so I think it's very safe. I think it's well within what we do all the time in medicine and research. But I also want people to be cognizant of the fact that they are volunteering for a research study, and if they're not comfortable with that risk, then that part of the research is really not for them. I would not encourage anyone to volunteer to do these PET scans if they're worried about that small dose of radiation. This is, something you're doing voluntarily, and you have to be comfortable with it.
So a follow-up question for you. What is the cost of doing a PET scan at Berkeley?
So we will offer these scans to our research participants at no cost, and we offer parking, and so there won't be any cost. It won't be billed to insurance. None of it will appear even in the official medical record. All of this is being done through research, and like all the other scans that we do as part of the research project, it's fully funded by the different foundations that support our research, private foundations, as well as the NIH.
Thanks. So there are a number of questions about aspiration. So would one of the physicians, aspiration pneumonia, want to address that? Michael? So what are the signs of aspiration pneumonia? And is there, let's say someone gets a feeding tube, is there a way to avoid aspiration of saliva, even if you have a feeding tube?
Well, some of this I'm going to leave for Joey, since this is really her area of expertise. But I'll just say that an early sign of aspiration would be coughing or choking with eating or drinking. And many of the things that Joey mentioned in her terrific talk about trying to prevent that, making sure that a person is always sitting completely upright, that their chin is tucked as much as possible when swallowing, those types of things can be very important to prevent aspiration pneumonia. What happens in aspiration pneumonia is that instead of food, basically liquid or food goes down the wrong pipe. Instead of going into the stomach, it goes into the lungs. And that can lead to when you have food or liquid in the lungs, it can be a source of infection. Bacteria can colonize there, and it can lead to an infection, or it just might lead to inflammation. The food or liquid shouldn't be there, and that alone can cause inflammation, which can be detrimental to a person. And some of the signs for that might be a fever, chest pain. And then for the nasogastric tube, I think maybe I'm going to leave that for Joey, or for Gil. Looks like he wants to answer too.
I just want to mention one other thing, which is that a sign of infection in patients who have neurologic diseases like PSP and CBD, certainly people can develop shortness of breath and cough and fever, the typical symptoms of pneumonia, but a very early sign might be actually a sudden decline in the neurologic status. So people suddenly are unable to walk at all, whereas before they could walk some. Suddenly people are very confused, whereas the night before they were thinking more clearly. These are, CBD and PSP are progressive diseases, and the symptoms get worse, but they don't get worse overnight or over a couple of days. And so anytime you see a sudden change in the neurologic status of a loved one, you should think about an infection, a pneumonia, or a urinary infection, which patients with neurologic disease are susceptible for. And the first thing to do is actually urgently to bring someone in for an evaluation with their primary care provider to test the urine, get a chest x-ray if needed, to make sure that that change in neurologic status is not the first sign of an infection.
And to response in terms of the saliva with aspiration pneumonia, going back to what I touched on in terms of oral care. So when we talk about someone that has a feeding tube, say, it doesn't prevent, of course, the aspiration of secretions. And since there can be more copious and excessive saliva, not because the body is producing more, but we're just not swallowing it down efficiently, there are agents that can help reduce the amount of saliva. We don't want to completely dry someone, but to kind of slow the production down. There's medications or even Botox to salivary glands that help with that. But also just keeping the mouth really, really clean, again, reduces the risk of colonization in the lung, reduces the bacteria in the mouth. So oral care is crucial, especially when you're not eating, because people tend to swallow less, and then saliva is a bigger problem.
Great, and just another question. And this could actually be for anybody, but how many people with PSP end up needing a feeding tube or end up deciding to get one? In your experience? Want me to fill out? So I'll try and answer that question. I think that many patients, probably more than half in my experience, and with PSP and often with CBS as well, will eventually reach the point where they can't swallow enough food or liquid to really nourish themselves. And it may be the majority of patients, and in some people that is probably what will ultimately lead to their death. In our experience, not very many of our patients at UCSF really have opted to get a feeding tube. And when people did make that decision, it often didn't end up well. And what I mean by that is that in some cases, when people ended up having a feeding tube placed, it became uncomfortable for them, and because some patients tend to be a little bit impulsive or have a little bit of altered thinking, we've had a number of occasions of people pulling out their feeding tube, which is placed through the stomach. So there's a tube that actually goes through the skin and into the stomach, and people have actually pulled that all the way out, which was very uncomfortable and can cause an infection. And we've also had situations that have been very difficult both for the patient and the family, because by placing a feeding tube, you're prolonging the person's life, but the quality of life often isn't very good. And that's because the movement problems, the walking problems, the thinking problems continue, and yet you're keeping the person alive. And so it can create some dilemmas, in my experience, for the family, because at some point you start to wonder whether the patient is really suffering and being kept alive in a state that really may not be pleasant. And so for that reason, my opinion is that often we don't encourage people to get a feeding tube, and we think I often don't think it ends well. But I think it's up to every patient and every person and their family to really discuss that and think about it. And some people do benefit, at least for some time. But I'd say the vast majority of people don't get a feeding tube in our experience, and we've probably had more negative outcomes than positives. Okay. You want to comment?
To that, I think it's really important because in these two diseases, especially, people have a lot of intact cognition, and it's really important to have those discussions earlier rather than later about what the idea of how they want to go through this disease would be. And so having those honest discussions with the family is really important to get those advanced care plans down on paper so that people can avoid making decisions later on that maybe aren't in keeping with the wishes of the person.
Yeah, I echo what Adam and Robin and others just said. But it is a very personal decision, and one can always, it is a decision that one can reverse. If you put in a feeding tube, it doesn't mean that you have to continually use it. And that should be part, perhaps, of the end-of-life decision-making. So just because you put in a feeding tube doesn't mean that you want it to be used for the rest of your life. You might decide that I don't want the feeding tube to be used if I'm no longer cognizant. So having those types of discussions with your loved one is really important. And there's no right or wrong, and as physicians, we're just here to help and to provide our own experience.
So I'm going to switch gears a little bit, and there are a number of questions about early detection of these diseases and how can we do it, how early can we diagnose PSP or CBD, or what are we doing to make progress on that? So does somebody want to address that?
This is a really good question about early detection of CBD and PSP. I think that probably most of the people in this room have had the experience that maybe they went to one doctor, another doctor, and then the ultimate diagnosis wasn't probably made at the first time they saw a doctor for any of the problems. And so early diagnosis is extremely important. As Dr. Rabinovici mentioned earlier, it's the trend in Alzheimer's disease. And I think that there's going to be two parts of it. One is going to be understanding families and perhaps genetic susceptibility to CBD and PSP. While we don't have known disease-causing mutations, understanding these risk factors will be important in understanding families. And on the other hand, early imaging, such as imaging done early in the course of the disease, such as the tau imaging that Dr. Rabinovici talked about, is going to be crucial. So in this way, kind of looking at who might be at risk and how to detect that risk are going to be two parts of solving this problem.
Yeah, so I think we can learn a lot about this from the Alzheimer's world. So, and from actually those rare people that have mutations in the tau gene that leads to PSP or similar diseases. So in the Alzheimer's world, we've started to do PET scans on people who carry mutations that cause amyloid, a different protein, to deposit in the brain and cause people to get Alzheimer's disease in their 40s and 50s. And the results are pretty stunning. The amyloid protein starts to deposit in the brain 20 years or so before people have the very earliest symptoms. So even people in their late 20s, early 30s, you can start to detect the amyloid protein. And there are studies beginning this year in Alzheimer's disease to see if lowering amyloid at that very early stage might be able to delay the disease. I think we're going to do very similar studies with people who carry mutations in the tau gene and see how early does tau begin to deposit in the brain in those rare people that we know with pretty much 100% certainty are going to get one of these tau diseases. And we expect the results might be very similar. Tau deposits in the brain are also very common as people get older, even if they don't have any thinking problems or movement problems. And we don't yet understand how much tau is it normal to have in your brain, say if you're 75 years old, versus how much tau might suggest that you're on your way to getting a neurologic disease. But with these imaging agents, we're going to be able to start answering those questions. And I think it's not science fiction, just like we screen for very early cancers with blood tests or imaging tests or colonoscopies, you know, pretty expensive invasive tests. These diseases are common enough that it might be worthwhile to screen people as people get older to see if they have one of these bad proteins in the brain and to think about treating those proteins at a very early stage. And with these imaging techniques and other markers, that's not science fiction, I think.
And just along those same lines, should children of a patient or a parent with PSP get brain scans for tau, and if so, at what age?
I think that this question is probably best addressed in the framework of what we're doing now with known disease-causing mutations. So, as Gil said, we're studying families who have a known mutation in the tau gene, and one of the big efforts is to sort of figure out, okay, well, how early are these changes occurring? We're doing functional MRI scans to see if there are functional changes in the way the brain is actually performing, because there are no real structural changes at an early age, let's say 30s or 40s. Now, in working with some of these families, I think we've all experienced a variety of attitudes where, you know, most people don't want to know their genetic status. Some people are very interested in research in their 30s and 40s and have even said that they want their kids or individuals who are 18 years old or around the teenage years to participate in the studies. And I think that overall, at the moment, we don't really know how early these deposits occur in the brain. And I think as sort of a general rule in our research, we haven't taken anyone under the age of 18, which is kind of considered the age of consent for research. However, there is research in children being done in general. And so I think this is an area that is worthy of open discussion, and where it's not something that I think we've actively encountered in our research at UCSF with children sort of being asked to participate in these sorts of research studies, but it's something that we do need to think about because we kind of need to understand these diseases as early as possible.
I think that was an important question. I'm going to take a step back, though, and say, so the question was if should children of a patient with PSP start to be imaged for tau or looking for other things? And first of all, even though there is an increased risk in family members of people who have PSP of developing a similar disorder, it's still incredibly small, very small. So I'll just give an example. Maybe you're going from a 0.25 to a 0.5% increased risk. But that's a doubling. 0.25 to 0.5 is still a doubling of risk, but the risk is really still very small. So just because your parent has PSP, your risk of developing PSP or similar disorder is still incredibly small. And most likely, one won't, by and large, one most likely won't develop PSP. But the reason why we're interested in finding those families in which there is there are several diseases within the family that might be related is that we might find those very rare genetic changes that do slightly increase one's risk. So most of the risks we're looking at have a small effect, or maybe a medium effect, but they don't cause the disease. So before we would ever start thinking about scanning patients looking for tau, probably the first thing to do is to find out what are the genes that are the risk and how much of a risk do they actually increase. To our knowledge, most of the genes that we think are involved in PSP increase one's risk very small amount, but that small amount might be important for us because it might help tell us the mechanism of why the disease is occurring. There's so many different pathways in the cell and the brain that might be affected. So for instance, one large study looking at genetics looked at over 1,000 people with PSP and several thousand controls, and they just looked for common variations within the whole genome. And they found 3 genes that seemed to be slightly more associated with people who had PSP. And these genes played a role in cell function. So one gene was involved in providing insulation to nerve cells. Another gene was involved in the trafficking of proteins to the garbage system that I think Dr. Miller had mentioned, the garbage system of the cell. And another protein was involved in other parts of trafficking of proteins within the cell. So it's those kinds of small changes in cell function that we might learn about. But it's really not that, for most of PSP, we're probably not going to find a gene that this causes the disease. And so that's why we probably wouldn't start just screening family members or children.
So everything I'm going to say is for people over 18. Let's separate this into 2 categories. The large category, over 95% of the patients that we follow in our research don't have one of these rare genes that causes PSP or CBD. They might have some assortment of these risks that, genes that cause a very small change in the risk. But for those studies, we are looking for normal volunteers for the PET scan too, meaning people who don't have neurologic symptoms. We certainly wouldn't exclude someone if they're the spouse or if they're the child of a patient with PSP. The important caveat is that we do not disclose PET scan results to people who are cognitively normal. We haven't done it with amyloid imaging, and we won't do it with tau imaging. So if you're volunteering as a cognitively normal person because your parent or grandparent or uncle or whoever has been diagnosed with one of these tau diseases, we would welcome your participation in the research because we need to have normal controls participate. We will not disclose the PET scan result to you. Then we have, the very small percentage of people who we follow in our research who do have one of these very powerful gene mutations. These families know who they are. There's a long-standing history of multiple people over multiple generations who have been affected with PSP or CBD. In those families, we will approach people and ask them at various ages, over 18, if they're willing to participate and get the PET scans. We'll approach people not necessarily because they have the gene mutation, but everyone in the family who is at risk. So people who have the mutation, people who don't, people who know their genetic status and people who don't. And again, our policy will be not to disclose the PET scan results, so the motivation to participate in the research should really be to try to help research around tau in kind of an altruistic way. Of course, once we have treatments, the need to disclose results will be very different, but at the moment, this is just part of the research to try to help us develop the treatments. So hopefully that makes sense.
So speaking of research, what is the best way to follow the progress of our research here for everyone who isn't directly involved?
One way to follow is to look at our website. We have a terrific website that some families who have come through our center have actually funded our website. They didn't like our website, and they said, here's money, build the best website in the world. And we think we have one of the better websites in the world for not only education of patients and families, but also of doctors. And so looking at our website for under PSP research progress, Caroline Latham runs our website and is always needling the physicians and staff to try to give updates on what's happening, putting our papers on there. Of course, the support groups also have a lot of information. Cure PSP, Brain Support, all these types of organizations are very good with trying to update and trying to give a layperson update on that. I think those are the... Oh, and then we have I'll let Robin talk.
Yeah. We have a newsletter that goes out periodically. Actually, we have a Facebook page, I think, is if you're on Facebook, it comes out on the Facebook page as well, as long as, and also periodic updates. Say if, for example, I think Dr. Geschwind was on the cover of the New York Times recently, so things like that come out on the Facebook page as well. We do have an annual event that participants in our research are invited to come to, where we give updates on the way that we've used all of the donated data that people give us by participating in our research, and we give them updates on that. And that event is also videotaped and usually goes up on our website as well. So it's another way to stay on top of what we're doing. And if you go into our website and look at an individual person like Dr. Rabinovici or Dr. Lee or Dr. Boxer or me, probably less often, but you can see what their latest publications are. And there's often a link to that publication with an abstract that sort of summarizes what the findings are of their latest publications.
Thanks. So I'm going to switch gears a little bit. And someone asked about anti-tau vaccines, and is there a possibility for a cure? And I think Dr. Miller alluded at the beginning that one of the really exciting things that we've learned from both the animal research, but also studying all of the different brain specimens and the brain images that we've collected here, is that it appears that tau, not only does it clump up inside of cells and cause problems for the cells, but it appears to spread from one cell to another. And this is something that people really didn't fully appreciate until about the past year or two. And what this means is that this toxic tau that we think is causing PSP and CBD is getting outside of the cells, and that means that some type of immune cell could come in and clear it, or immune protein. And so a vaccine is when we take a protein usually and we modify it in a way that the body will recognize it as something foreign or toxic, and the immune system will come and clear it out. And in a variety of different animal models that get tau-related neurodegeneration, where we take a human tau mutation and usually put it into a mouse, if you vaccinate them with abnormal forms of tau, or you give them an antibody, which is what your body would make in response to a vaccine, you can actually see really dramatic effects on the animals. So the tau doesn't spread throughout their brain, it doesn't build up, and the animals do much better. And so we're really excited about this technology. And there are quite a few treatments that are really approaching human clinical trials, we think within the next year, that are going to use this approach. A vaccine itself is where we give you something where your body creates an immune response, and those are a little bit trickier to produce, and they can have more side effects. So we probably won't see a vaccine as quickly as we will see some of these other antibody treatments. And we think that those are really promising because, again, we're making human antibody versions of the antibodies that just had really huge effects in mice. And if they work even half as well as they did in the mice, then we think it really could offer some benefit for people. So we're really hopeful about this. Is there a possibility that these types of technologies could be a cure? I think there is a possibility. I don't know what percentage chance, but I think we're very hopeful. And I think of all the treatments we've had to investigate in all of these diseases, to me, these are the most exciting and most promising. And so that's really one of the reasons why I'm so optimistic for the next year or two, because we'll really have the opportunity to start to look at these drugs. And I think we also have to be cautious. We've had many failures in the past, but this seems promising. And even if these drugs don't work, or if this approach doesn't work, it's likely that we're going to learn a whole lot about the diseases and a whole lot about ways that we can treat them better, even if they don't work. But I think there's a chance they might. Another question was, could nighttime leg cramps be caused by PSP? Can I answer that?
I think one of the clinicians may be able to address this as well, but as far as we know, yes, leg cramps can be a symptom of PSP, especially at night. And it's to do with this imbalance of trying to clear some of the systems so you can have a buildup of, I'm blanking on the right word right now, buildup of toxin essentially that's going to trigger that leg cramp. It's someone else want to drink plenty of fluids, but not shortly before you go to bed throughout your day, and that should also help to decrease it.
Cramps are really common. They're usually not going to be due to PSP. I don't think it's often a first symptom of PSP. So if people are experiencing leg cramps, stay hydrated. There's a lot of other reasons, but it's not usually the first symptom of an emerging PSP.
Yeah, I think sometimes people with PSP and CBD, as the disease gets worse, you start to have more cramps or the muscles contract, and that can be very uncomfortable, can interfere with sleep, can be uncomfortable during the day, and in that sense, certain types of cramps and what we call dystonia can be related to both of these disorders. And it's important to know that we have pretty good treatments for dystonia and for cramping, and there are a number of different ways that we can address this. Some are just through physical therapy, others are through medications or injections, and so it's important that if you or your loved one has these types of pains or discomfort, that you let your physician know, because you shouldn't suffer with that. That's something we can help with. Another question is, do you go blind with PSP? I think classically, PSP, Richardson syndrome that we described, the classic form of PSP, often does affect vision, and often will cause double vision or droopy vision or have droopy eyelids, but it doesn't usually affect the optic nerve, which actually takes the signals from the eye to the brain, and so you don't actually go blind from PSP, but sometimes the double vision or the sensitive eyes or the droopy vision or the difficulty with opening up your eyes can make it hard to see or hard to read or hard to enjoy things. And again, we don't have a cure for this, but we do have a number of different ways we can address problems like droopy eyelids or double vision, and so often we can help with that. I would say there are some cases where people really have a lot of trouble seeing from the PSP, but again, it's something that we can often do something to help with. Are CBD and PSP always separate diseases? Can one person have both?
I'll take a stab at it. Adam's probably, could answer it maybe better than I could. So I think of it, of PSP and CBD as a spectrum of tau diseases. The type of tau that is depositing in the brain is very similar biochemically, but the areas and the shape of the tau is a little bit different in PSP and CBD. In some cases, the symptoms are very much classic Richardson syndrome, classic CBD. In a lot of patients, there's kind of a mix of symptoms, some symptoms of CBD, some symptoms of PSP. So I think the symptoms are really on a spectrum, and I think the pathology can be on a spectrum. So sometimes Leah Grinberg or Bill Seeley or Dennis Dixon can look at a brain under the microscope and clearly say, this is PSP or this is CBD, whereas in other cases they can say, well, it's the tau protein that's caused the problem, and it's the kind of tau protein that we see in PSP and CBD, but there's overlap in the areas of the brain that were affected and in how the tau looks in the brain, and this is kind of an overlap case that's somewhere in the middle. between PSP and CBD. Leah, I think, mentioned in her talk that we might have different treatments for PSP and CBD ultimately. I hope she's wrong about that, actually, because I think that it's going to be very hard for us to separate those two diseases during life, regardless of what kind of imaging technologies. But because the tau is so similar, and because those two really exist on a spectrum, I'm very hopeful, actually, that if it's an antibody treatment or a drug that you take, that a treatment that will work for PSP will work for CBD and vice versa.
Yeah, and I would just say that we've been working internationally on a number of efforts to improve the diagnosis of PSP and CBD, and one of the efforts completed last year with a paper where we came up with new research criteria for CBD, and these were published in 2013 in the journal Neurology. And I think we had we went around for years arguing about the best way to diagnose CBD. And I think that everyone felt that, and there was even a movement for a while that we not even try and distinguish between PSP and CBD, that we just call them all 4-repeat tauopathies. And in fact, that's why we named our study the 4-repeat tauopathy neuroimaging initiative. And the reason why is that for PSP, we're very good at diagnosing it and being accurate about a diagnosis. So if someone has the clinical Richardson syndrome, the typical PSP, and they go to autopsy, in most research centers now, probably almost 95% of the time, they have PSP or something very close to it at autopsy. And when it's not PSP, it's almost always corticobasal degeneration. So if you say, well, did someone have, if you want to be sure about the diagnosis at the autopsy level, and somebody either has clinical PSP or clinical corticobasal syndrome, and for corticobasal syndrome, if we rule out Alzheimer's disease, you can be almost certain that greater than 90% of the time, in most cases, it's going to be a 4-repeat tauopathy, which is really PSP or CBD. So I know that's a long-winded explanation, but we think that they're very closely related. They have the same flavor of tau in the brain, and so that makes us hope that a treatment for one will work very well for the other. So another question was, what about medical marijuana for help with sleep and pain? I don't have any experience with that. I don't know whether any of the other physicians do either. Not something that I personally can recommend for a patient. I think, many people will go through different trials of different drugs to help treat them. Unfortunately, there is nothing that's approved by the FDA for treatment of either PSP or CBD or anything that's really been proven to be effective in a long-term clinical trial. When patients ask about medical marijuana, we often at least bring up the point that when you have PSP or CBD, your thinking is already a little bit slowed, and so I worry at least about giving someone something that's going to slow their thinking even more and make it harder for them to concentrate and enjoy their families and their life. And so for that reason, I'm not a huge fan, but I think the other clinicians here might also have opinions.
Also, medical marijuana can actually increase the likelihood of sleep apnea or exacerbate some of those symptoms. So you're also probably actually disrupting your sleep, even if it's just for small fragments where you may not realize it the next day. So from the sleep perspective, take caution.
Anybody else? No? Okay. Okay. So I think there were some more questions for Joey and for Christine, and I think we're not going to be able to get to every single question today because we're running out a little bit of time, and I want to just give everybody a last-minute chance. So if there are questions that you wrote down and they didn't get answered right now, then please email Christine Walsh, or if there's a question for Joey, you could email her directly. Or actually, Christine will field them. So just one last question here. So I'll answer this one. Why is it easier to develop treatments for PSP than for other diseases like Alzheimer's? And we think it's easier because even though tau is very much a part of Alzheimer's disease, there's also this other protein called amyloid that Dr. Rabinovici mentioned. And Alzheimer's disease in some ways genetically is even more closely linked to amyloid protein than it is to tau protein. And moreover, when people have looked at a lot of patients with Alzheimer's disease at autopsy, it's very uncommon that someone even just has pure tau and pure amyloid in their brain. They usually have strokes, sometimes they have Parkinson's disease, sometimes they have other proteins in the disease. And so we think that other diseases are much more heterogeneous in terms of their brain pathology, and that creates it makes it difficult to see the effects or to see any benefit of a treatment that's just targeting tau protein. So let's say if we were able to remove tau protein in PSP or CBD, we'd be pretty darn confident that that's going to have a huge effect, because that's really the main protein there and the main protein that's causing problems. In Alzheimer's disease, we're not sure. Even if we remove tau, maybe the amyloid and everything else that's going on would make it too hard for us to really see a benefit. And so that's why we have been really trying to convince people to focus on PSP and CBD. And obviously, the other reason is because we need some good treatments for these diseases. But so I think we're just going to, we have about 5 or 10 minutes left, and wanted to ask anybody who has a question, a burning question that we didn't address, whether they want to raise their hand now, because we have about 5 minutes, and we'll try and bring a microphone over to you.
Hi, I have PSP, and I was just wondering about the hand thing, about not being able to write. I can't, it's been years since I have been able to write effectively, and I just wondered if that was part of PSP or something else.
So yes, I think we often see people with both PSP and CBD who have trouble with writing, and there can be a variety of different reasons that definitely we should discuss, or you should discuss with your physician. Sometimes, I don't know for you in particular why it's a problem, sometimes it's a problem that we call apraxia, where it's difficult for your brain to come up with the commands that you need for a complicated movement. And that tends to be more classically seen in Corticobasal syndrome, but sometimes also in PSP. Sometimes people just are stiff, and you may be stiff, or you may have a little bit of other problems with controlling the muscles in your hand. That can be another problem, or sometimes it's just hard to move as much as you want. So but it's not uncommon that we see handwriting problems, and again, depending on what the origin of the problem is, we may be able to help you with that.
Thank you. Presumably, the tau gene would be present in every cell of the body. Is that correct? But it's only expressed in the brain, or is it expressed elsewhere?
Dr. Geschwind, do you want to?
In the brain. It's when we look at patients who have these diseases, we're finding the accumulation of the protein in the brain. So just because a cell has the gene doesn't mean it's going to be expressed, and those are the promoter regions. That's to my recollection.
Yeah, so tau traditionally is thought of as a neuron-specific gene, and mainly it's expressed in neurons in the brain. It is a little bit of a mystery to all of us why in both CBD and PSP we see a lot of tau accumulating in the non-neuronal brain cells, what we call the glia. And it's not clear why that is. I think if we understood that, that would help us to understand these diseases a lot better. Any other questions?
Yes, there's, from what I've read, there's 3 or 4 different types of PSP, and there's one that is progresses faster. I'm not sure if it's RS PSP, and so I'm wondering about that. How do we tell if we have that?
I think with all of these diseases, there's quite a lot of variability. Even with two people who may have the exact same symptoms, we don't understand why, but some people will progress much more quickly than others. But within PSP, since it was first described, or really in detail, in the late 1960s, we've recognized that not only is there the classic, what we call Richardson syndrome, where you have falls and eye movement problems as really the most prominent and early signs, but there are other forms of the disease. So there's, as I think Robin Riddle mentioned, there's PSP Parkinsonism, or where people look like they have typical Parkinson's, but then they go on to get PSP. There's other problems one's called pure akinesia with gait freezing, which we think is another form of PSP. Sometimes people with PSP will begin their disease looking like they have a memory or behavior problem like frontotemporal dementia, and others will have what we call a primary progressive aphasia, where it's really a trouble with language or speech mainly when it turns out to be PSP or CBD. And what the studies are indicating when we look at these different groups of patients, that the patients who have the typical Richardson syndrome tend to progress the most quickly. And patients who have these more unusual presentations tend to be a little bit more slowly. And if we look at their brains at autopsy, the amount of this tau protein that builds up is the most has the greatest extent and the most amount of it in the typical Richardson syndrome in the patients who tend to progress more quickly. And these other forms, there tends to be more limited accumulation of tau. And this, again, is more of a reason why we think that drugs that could reduce tau might be effective, because people who we know who have less tau in their brain but still have PSP tend to have a less severe disease. One of our goals, so we're actually writing new PSP research criteria right now that we hope are going to be done in about a year. And actually, this is going to be the 50th anniversary of the Steele-Richardson and Olszewski paper is going to be this year, or the first description, I should say. And so we hope that hopefully by the end of the year we'll have a draft of these new criteria. And to me, the most important component of the new PSP research criteria that we're working on is the ability to detect these diseases much earlier so that we can intervene with a therapy. And so particularly we want to look at these unusual forms of PSP, maybe with tau imaging or genetics, and understand could we get these people to treatments earlier so that they would never get the disease as badly. Other question?
Thank you all. Great session today. Appreciate it. I had a question about, are there any more theories or hypotheses on what environmental causes would be? I understand that genetics increase susceptibility. So my mother has PSP, so I'm wondering for myself what I could be potentially avoiding environmentally or otherwise.
So that's a great question. And Irene Litvin at UCSD just finished a study called PSP Engine, where she looked at where she and her colleagues around the country collected a lot of patients with PSP and looked at them and their families and looked for environmental risk factors. And I think that there did seem to be a hint that there were some environmental risk factors that could potentially promote PSP, and they were interestingly similar to what we had known to be associated with Parkinson's disease. So possibly like heavy metal exposures from welders, possibly also certain types of pesticides. And interestingly, in every study of PSP epidemiology that I'm aware of, low education seems to also come out as something that's associated with PSP, and we don't know if that's really a risk factor or what, but those are sort of the three things. And I think the challenge is that we need to study a lot more people to be sure about these risk factors. In Parkinson's disease, we have much bigger studies. They've had more funding. It's a little bit more common, and so we can say it with a lot more certainty. In PSP, we're not 100% certain, but it seems pretty likely that pesticides and possibly heavy metals may be risk factors as well, or certain types.
If I could add to that, the sort of the advice that we generally give our patients, because what we've learned, particularly from more common diseases such as Alzheimer's disease, is that there are several things that can reduce one's risk for developing dementia. And one is higher education. Obviously, once you're an adult, it might be a little too late. But certainly trying to keep socially and mentally active, cardiovascular activity. So we put all of our patients who have cognitive impairment, as well as people who are concerned about developing cognitive impairment, into an active cardiovascular exercise program. We try to make sure that they're socially involved. People who are more socially involved, have more social interactions, aren't hermits at home. They tend to have a lower risk of developing dementia. And then in terms of the pesticides, it's not, these are people who have been exposed through a lot of pesticides. So, of course, we always recommend that you wash your fruits and vegetables very well. But it's probably not the common daily little exposure you might get from eating it, but people who actually live in the areas in which there are a lot of pesticides in the groundwater or who work in the fields. So it's higher doses of pesticides, probably. But wash your fruits and vegetables.
Well, I think our time for today is up, but I wanted to thank all of you for coming out in the rain, and again, thank all of you for your participation in our research, and we really couldn't do it without you, and we're very hopeful for the future. We're recording this, and I'm going to actually let Robin come up in just a sec, this is all being recorded. We will post this on our YouTube channel. If you have additional questions, please email them to Christine Walsh. And again, I wanted to thank Christine and Robin for organizing just a terrific day today. And Robin, do you want to have?
Yeah, I have a few comments. Yeah, just real quick, our Brain Support Network plans on a webinar series this year, a quarterly webinar series, and we hope to invite Dr. Boxer to be one of our very first webinar speakers. So be sure to sign up on our support group list. If you're not already in the support group, then there's a list outside on the table. We'd also like to thank Christine Walsh, wonderful job at UCSF. She was a great person to work with. Within Brain Support Network, our lead person was Sharon Reichart, who did 99% of the work. And then up until 3 o'clock this morning, working on our name tags was Stephen Russell of Brain Support Network. About half of the people in the room RSVP'd this week. About 10 of you RSVP'd yesterday, so we had a very changeable list, but we're so glad so many of you did come. It's very important, speaking of name tags, that we get your name tags back. This little name tag's been used and reused many, many times. We like to keep doing that. 4 of us have bags, and we'll come around and collect name tags. Also, just as important are those surveys. Everyone should have a survey on the table in front of them. Please fill out a survey, and we'll collect those in our bags as well. And I think that's it for me.
So again, thank you to Christine Walsh for doing all the work to organize this from my end. And thank you to everyone and to all our speakers.